Alors, mesdames, messieurs, chers...
So, ladies and gentlemen, dear colleagues, welcome to this press conference to talk about the Quebec situation on COVID-19. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, and the National Director of Public Health, Dr. Horatio Arruda. Mr. Premier. Yes, thank you. Hello, everyone. We learned at 8 p.m. last night that there were 31 deaths at the private residence, the one called Herron in Dorval in the west part of Montreal. Up until now, we don't have all the information, but this is the information that we do have, and we'll give them all to you. First of all, the 26th of March, there was one patient who was sent to the Jewish General Hospital, was tested positive for COVID-19 and died. On the 29th of March, that's 3 days later, the CIUS received communications from Herron residents and decided to visit the establishment. They saw right away that there were serious problems. In certain media, they even talked about it. A good part of the staff had abandoned the center. So as of the 29th of March, the CIUS of the west of Montreal sent staff in order to care for the patients and take care of them. However, they did not have collaboration on the part of the owner of the Herron residence, and they were forced to ask for an order in order to have access to the patient files. So that's last night at 8 p.m. that they were able to finally take knowledge of the patient's files. And so it's last night at 8 p.m. that they saw that as of the 13th of March, there had been 31 deaths. So this is a residence of about 150 people. And of course, it's huge, 31 deaths in a few weeks. For the time being, we do not know how many of these people died of COVID-19. We know that there's at least 5, but we do not have the information yet for the other 26 patients who have died. So Public Health and the Ministry of Health have triggered an investigation. The Health Department, Ministry and Public Security have also asked for a police investigation. What we have to know is that we're still doing research. The owner of the Herron residence is also the owner of a few other residences, and we are making up a list, and all those residences will be visited. And in Quebec, we have 40 private CHSLDs that are non-conventioned. We've asked that they all be visited to make sure that everything is under control. When I learned the news, well, that's why I decided, I wasn't supposed to be present today, but I want to come tell Quebecers, first of all, that that's terrible what happened at the Herron residence, and that we are, of course, going to make sure not only in that residence, but in all others, that we care for our elderly correctly. We are transferring staff from hospitals to the residences, but I want to tell Quebecers that I find that it's not acceptable the way that our elderly are treated in Quebec. It's been a long time that we've known that there's staff missing in CHSLDs, that the staff is not sufficiently well paid, particularly in the private sector. We've added resources in the course of the past year, but I'm not proud to see what is happening in our CHSLDs. And of course, we are going to start by managing this crisis right now. But once the crisis is under control, I want us to review every way that we do things in those residences for the elderly. We owe it to our elderly to take care of them to care for them with dignity. And I want to give my word to Quebecers that we are going to take every necessary action so that in the future, in our residences, we care of our people well. You know that we already have a project to have a home for the elderly, or these homes where we have more space, where there's fewer people living together, where there's more staff that is better paid. But I want to give my word to Quebecers that we all have to together learn lessons on the insufficient way that we have been caring for our elderly in the course of the past few years. The numbers of the day. We have 48 new deaths today, so for a total of 289. I, of course, wish to offer my condolences to the families, to the people close to the victims. We now have 12,292 confirmed cases, an increase of 615. However, on the hospitalization front, we have 778 people who are hospitalized, an increase of only 45, and 211 of those people are in ICU. That's an increase of 25. So as you can see, in the hospitalizations, the situation is under control. Of course, we have to go take care and manage of the CHSLDs and the residences for the elderly. And since I'm here, I want to take this opportunity to come back to the question of the reopening of the schools. Perhaps I should be more precise to reassure parents, because I saw last evening, amongst others, a lot of parents were worried about going back to school, whether it be before or after the 4th of May. I just want to say one thing. I am not going to allow for schools to be reopened first, as long as I don't have the agreement of public health, and as long as I don't think, are the children safe. The day that we reopen the schools, it'll be because I would be ready to send my own children back to school. So there is no question of having any compromise. Yes, I was transparent. We are looking at different scenarios with different dates before, during, after the 4th of May, but there is absolutely nothing that's been decided. And there's going to be the one and only criteria, and that is health. Health. It's not economy, it's health. The health of Quebecers. That is going to be the thing that will make us decide when we'll reopen the schools. That will predominate. And of course, every day, every week that is coming up, we're going to follow the situation of the contamination. And we are going to be making decisions that are in the interest of our children. Our children is what we have that is the most important. And maybe one word on medication. The protective equipment is going well, the situation is improving, and we're getting help from certain provinces. I won't necessarily name them, but I'll be able to tell you a little bit more in the course of the upcoming days. But we do have a problem with the medication. I prefer being transparent about it. There's about 20 different medicines where we have for maybe a week's worth. We're having problems procuring these. Of course, there are substitutes for certain medication. We're talking with the federal government and the other provinces in order to see how we could find solutions. But I did want to say, since I've said since the beginning, I want to tell the population the truth. There's certain medication where we do have concerns. So I would like to end by repeating. First, in the short term, we're going to do everything to care for our elderly well. And then we are going to be taking the necessary measures so that all of our elderly in Quebec, whether it be in public or private residences, are treated with dignity. Thank you.
Good afternoon. I'm here because of what we learned last night about a situation in a private senior residence in the west of Montreal. Yesterday evening at 8, we learned that since March 13, there's been 31 deaths at Residence Herron, which have about which has about 150 beds. Out of those 31 deaths, we have confirmation that there's at least 5 coronavirus cases. Public health authorities are currently investigating, and we've also asked for a police investigation. Here are the facts we have in our hands. On March 26, a first patient was sent to the Jewish General Hospital to be tested, and it became a confirmed case of coronavirus, and he died. The CIUS then communicated with the residents and went to visit it on March 29th. Most of the staff had then deserted the residence. That day, the CIUS sent health workers to take care of the patients. The owner of this residence refused to give us access to the file of the patients, and it's only last night at 8 p.m. that we learned that the number of deaths since March 13 was 31. The same person also owns few other residences in Quebec, and our teams are currently investigating them. We also order an immediate verification of all of the 40 private SHSLD in Quebec. Thank you.
Merci. Alors, si vous êtes prêts à prendre les questions.
Thank you, sir. If you're ready to start with the questions now.
On a des témoignages.
We have some testimonies on the part of doctors and people in the health network that leads us to believe that now there is a situation that is atypical in Quebec. That's the least that can be said for it. And that could lead one to believe that there are other Herron-type CHSLDs, and that perhaps there are problems that go beyond the CHSLD that would be in the health ministry, that there are people who are just too tired that talk about situations that are particularly difficult. To what measure can we have the certainty that there's no other situation like this, that we're not going to learn where there's another private CHSLD where patients are treated in that way? Are we just reacting to what is going on, or are we ahead of the wave? I will start by saying that every morning we have the full list of each CHSLD with the number of cases that are confirmed. And here the information was hidden, so of course it's difficult to worry about a CHSLD that is hiding a situation from us. We thought that there were a few deaths, a few confirmed cases. But I can tell you that a follow-up, like we said before, we asked that the 40 private CHSLDs that are non-convention be visited, so in the following hours, to make sure that there isn't other Herron-type residents in Quebec. And Daniel's team is continuing to follow the situation very closely. Unless we have missing information, we are able to see where the critical cases are. We gave you 6 a few days ago, but we are making decisions with the information that we have. And what I wish to add to complement what the Premier said is that today we are sending teams that are going to be checking on the premises, the 40 private housing centers in Quebec. So we're going to making verifications. We want to help them if they need it. So that is being done today. I'm going to have a report at the end of the day. And we're investing. We gave 40 million in the budget for private CHSLDs. We want them to invest and add staff. So we're going to be helping them with that. We did the same thing for intermediary resources for the elderly. We have 25 of them. We want to help them find staff and add resources, but we will be making verifications, and that will be done in the very short term. We want to have a report. We want to know what's going on in those residences and in these resources. We want to have all the information. In that context, considering that Quebec is perhaps the most hit province by the epidemic right now. I mean, we are very much more negative in Quebec compared to the other provinces. Is that not our Achilles tendon more than the March break? Isn't it the critical situation that's been going on in CHSLDs for a certain number of days that explains the fact that Quebec stands out so much compared to the rest of the Federation? Well, first, I want to tell you that when we compare ourselves, apart from Ontario, we have many fewer deaths than, for example, in the United States or in those European countries where there are big cities the size of Montreal. The only province really that has one big city is Ontario with Toronto and also, Vancouver, but they also had a lot of deaths. But when we compare ourselves with the United States and Europe, we have fewer deaths, including deaths in CHSLDs, the residences for the elderly. And as I've said already, we were expecting there to be a lot of deaths in CHSLDs because in CHSLDs is where we have the people who are both older and ill. So it's normal that there's going to be more of those people who are hit because they are more vulnerable. There's about 70% of the deaths, but I don't think that that is different from countries that have a system such as ours. Mr. Premier, Ms. McCann, Mr. Arruda, on the situation at Herron, you said that public safety is going to be investigating. Is it your government that asked, or is it the SPVM who is going to investigate on that, the Major Crimes Unit? Is that at the request of the government, that there is a criminal investigation? Yes, it's at the request of the Health Ministry and Public Safety Ministries. You said earlier on that you wanted to do everything to make sure that from now on the elderly will be better treated in our society. In margin of the pandemic, what you've done is that you've improved the working conditions, amongst others, of the orderlies. You've granted them premiums. Could you reassure those people that those premiums will remain after the crisis and that they won't end up exactly in the same situation that they were in before the crisis? Yes, I can give them I can assure them, yes, because in fact in our CHSLDs and the private ones, we had people who made like $13 an hour, for example, to care for our elderly. So that is why we've given a bonus of $4 an hour. It's been a long time that we've known that this is a problem, and I'm talking about many years here. In public CHSLDs, employees are closer to $20 an hour and more. So there is a gap here. And we can't say, well, that's a private, we're not going to worry about it. These are our elderly. And that is why I'm saying I find it unacceptable. We have to change it. And of course, that presupposes as well having more room. So when we're talking about building homes for the elderly, we can't from one day to the next offer people. You know, the concept that we have first is to no longer have these centers that have many hundreds of residents. We want them to be smaller, with more space per resident, to be able, you know, when there's a situation such as a crisis, to have a hot zone and a cold zone, to be able to have more staff, competent staff that is well paid. So it's all of these things that we're going to be looking at for housing for the elderly and in the renovation of CHSLDs right now, the present ones. Now, it's difficult to act in the short term because we're missing space to be able to do what it is that we want to do. And as a complement, what we're doing right now, there's a lot of that is going to stay. We're sending a lot of reinforcements right now, and that's going to continue. Next week, we have people from the education sector. Of course, are going to, you know, eventually go back to their original job. But for the time being, for the upcoming time, they will help us out. People from the education who are going to be arriving as of next week. We are reorganizing the teams, and we want it to be as airtight as possible between hot zones and cold zones, but also we don't want people to go from one unit or one building to the next. So these are ways of doing that we want to keep, and it's also going to help us for the flu season, because that's also another virus that goes around, and there's also the entire medical coverage. By that I mean our family doctors, and now there's 450 that are coming to help us now. And now there's new ways of doing things, you can be over the phone, you can do a teleconsultation, you can go to the premises, and we have to see with all these people, we have to see to the people who are in CHSLDs, but also in the residences for autonomous elderly and in intermediate resources. And now we're setting up telecommunications means. We want for our elderly to have medical coverage that is sufficient and adequate. So that is what we're working on. And of course, after the crisis, we're going to want to keep a lot of these transformations that we are undergoing. But now we're managing the crisis. In light of this situation that you qualified yourself as being appalling, Mr. Premier, and he's right, at the Herron CHSLD, is your government, since you're talking about the future, could your government set up an inspection system that is more regular, not only in CHSLDs, but also in all residences for the elderly? And why not also include all the other residences that belong to the people who were in charge of that CHSLD? Well, first, I would like to remind you that before the COVID-19 crisis, remember, Marguerite Blais visited over 100 residences, and she was telling us there's a lot of work to be done in many of these residences. So, of course, and I think that we can't separate public and private, we have to look at how we can, first of all, better fund. Of course, if we fund things better, despite the fact that people pay very high rents in places like the Herron residence. So we have to be able to make sure that the services are given, that the staff be hired, that the competent staff be hired, that they be well paid. There's an entire construction site here. Remember in the last election campaign, that was one of our important commitments, that homes for the elderly would be completely reviewed, so that we could, change the way that we care for our elderly in the residences. So that's something that we won't be able to do in just a few months, perhaps not even in a few years, but we have to completely review the way that we render services in those centers. You referred earlier on to your words that raised a lot of comments concerning the possible closure of schools. There's another element that led to some confusion yesterday concerning the cancellation of cultural and sports events until the end of August. First, why not having made that announcement yourself yesterday to avoid there be confusion? Your government sent a press release instead, and many questions remain without answers. Is it possible for you today to clarify that situation about these sports and cultural events? Well, what we said yesterday is that large-scale events, festivals, cultural events, etc., are going to be cancelled until the 31st of August. We think that it is not realistic to put thousands of people, one on top of the other, with the situation that we are experiencing today. Now, as far as sports events are concerned, I think that Isabelle Charret explained it. If there's a baseball tournament, if there's a tennis game, can those events think of being held in July or in August with the guidelines that we will have at that time? Because we have guidelines today of, keeping 2 meters between people, but there will be guidelines that will be evolving over the next few months. So is it possible that, for example, certain sports events can be held while respecting the 2-meter rule, for example? Well, we're not going to totally exclude that, but I think that it was important to send the message to the organizers of big events and to say, well, stop spending money to organize these things, because we don't think that you are going to be able to have your event by the 31st of August. And the idea of the smaller events, sports events, listen, I'm thinking, for example, about hockey. In the days before confinement, there were hockey games, but with nobody in the arena watching. Is it feasible to review this? I don't want to exclude anything, but for sure, we're not going to go and put thousands of people in a festival before the 31st of August. Next question. Hello, Mr. Premier. We are feeling an important gap between the level of preparation of hospitals and prediction of the pandemic, and there's a level of preparation that was achieved, and the ones in the CHSLD. Do you recognize that there was a problem on that aspect and that was partly responsible for the situation that we're experiencing today? Well, first, the CHSLDs, we've been talking about them for a long time. We didn't start doing that yesterday. We've been saying for years, is there enough staff? Is the staff paid enough? And I'm making a difference as well with the private CHSLDs, because it remains that in Quebec, we made that choice of having private centres, which, whether they were conventioned or not, and that manage their own things. So should the government go and see what is being done in the private residences? I think that more and more, yes. And what we've done in the past few months with Marguerite Blais is to add inspections. But at some point, we're going to have to put standards on how many people there have to be, how many nurses, how many doctors per, 10, 50, or 100 residents. So to have guidelines, to have standards, I think that we have to work better so that the private sector be better prepared for another crisis. So to answer your question, perhaps the private residences were perhaps not ready to face a crisis. I have no doubt that you receive a lot of emails, people asking questions and things. We'll receive a lot of them as well. We asked a question earlier. The closed ones of the family, are they informed of the state of their loved ones who are in CHSLDs? Because it doesn't seem to be the case. We're getting a lot of testimonies, Mr. Legault, and I'm just going to quote one. A person who has no news. Her father already died of COVID-19. Her mother has COVID-19 and she has no news. After having cried, being anguished, I unite myself to all those without a voice who will lose a loved one. In my heart, I hope that this testimony is going to allow us to change positively and quickly how things are being done. Do you understand that there's a gap between what is said here, what's going on in the field? I also think that there is a gap between the guidelines that is given and what is human possible to do in certain places. The guideline that is given, and I would say for at least a week, is that in all centres they have to notify the families. The guideline is very clear on that. Are there certain centres that are overwhelmed and that they think it's a lot more important to give care than to call the family? That could have happened, but I think that those remain the exception. And what we're talking about yesterday, Danielle and myself, was to say maybe we have to hire people who could do just that, because they don't necessarily need to have a doctor or a nurse that calls the family to give information on the resident. So that is part of the work. Our objective is that all families be made aware. But yes, I can see that there's been exceptions. Mr. Premier, you seem to be completely overwhelmed by what is happening at the Herron. Are we facing a case of criminal negligence, and who is going to be accountable? Of course, there's going to be an investigation. I have to be prudent. Honestly, I don't feel like being it. I think that there's a lot of negligence that took place at the residence. Now, the investigation is going to show exactly what happened, but I repeat, when the CUS arrived on the 29th of March, almost all the staff was gone. It makes no sense that we arrive in a center and that most of the staff is gone. So I think that it looks a lot like major negligence. Madam Minister, sources and information are confirming that there is disorganization as well in public CHSLDs. In certain places, the staff is left to itself. There are people who show up, people who leave earlier. Do you really have a true idea of the situation in CHSLDs? And I do insist upon the word, these are public CHSLDs. Well, yes, listen, we have a report every morning. We go over them. We have CHSLDs where there's more confirmed cases, and those we follow very, very closely. We talked to you about them yesterday. There's a few that are, in fact, centers where we have to keep an eye on things and we have to support more and add staff. And that is the main issue. The main issue is having the staff, because we are in a situation where when there's a CHSLD where there are confirmed cases, well, unfortunately, there's also workers who have been affected or who were affected by the coronavirus or who are contacts. So then we have to send a different team to help them. And that is why it is so fundamental to go get people from the hospital sector that we bring back to those CHSLDs, but also the education, the people from the education sector coming next week. So we have a very, very narrow follow-up of those CHSLDs. We know where there's more difficulties because there's more suspected cases or confirmed cases, and we are following them very closely. We are in communication with them, not only every day, but sometimes from 1 hour to the next. Since we are fewer today, I can take a couple of extra questions. I would like to bring to your attention that 2 years ago, a report had been given on the Herron residents, and I would like to read to you a few of the things. The lack in the quality of the care and services, lack of competencies, of follow-up, of staff training, deficient approach with the residences, especially those with cognitive problems, incapacity of the nursing care to take care of the wounds of the residents, not doing their obligations, a lack of continuity in care, because there's an insufficient that staff that are not replaced when they're off, lack of information transfer between the members, delay in assistance when they are called, calls remain without any answer, limit of the number of incontinence diapers per day. So there were very important lacks here and shortage. That was in 2017. How can it have lasted until today? A report such as that, of course, is transmitted to the ministry, is transmitted to the establishment, and the establishment has the duty to make that link with the private center and to bring the corrective measures together with the center. So, and now I don't have the information, but I presume that corrective measures were brought because that is what would have needed to have been done. Because that is a report from Protector of Citizens, and they have the responsibility of making. I was in the network for years, and in fact, that is what is done, and it's very serious. So I believe that there was a follow of that report that was created by the Public Protector in 2017, but in the context of COVID, there was a degradation probably, and now we are, of course, going to do every action that we're talking about today, and there's going to be an extremely, extremely serious follow-up of this entire situation with the elements that we're bringing to you today. So we're even going to review what was done in 2017, but those reports on the part of the Public Protector has an obligation on the part of the establishment and the ministry to create that report and to take the necessary corrective measures. I wish to talk about the issue of the medication. You're saying that there's about 20 medicines that are at a risk of shortage within a week. Would it be possible to have the list of those medications? And to what extent are they currently used to treat people whose state is precarious? Well, the first thing that I wish to say is really just to, it's about 20 medications, but has a lot to do with sedation, because I don't want the population to think that it's all kinds of medication. No, not at all. It really is medication that are used in sedation. When you intubate somebody, for example, a propofol I talked about already, and there's others. So right now, in fact, our reserves, and also what I wish to explain, is that we don't have reserves of these medications in establishments or medication generally. We don't have huge reserves. Usually we order from suppliers just on time, that is, we have a reserve, but it's not that great, and the medication that we need come in as we need them. So it's the same thing for sedation medication. So about 20 of them. And we are in link with our suppliers, but we're also negotiating with the federal government. There are possibilities on that end. So what we're saying today is that we are transparent. We have at least a week's worth. We do have what we need, but we want to get more. And that's why we are speaking with the suppliers and the federal government. But I could give you a list, but generally speaking, there are medications that have to do with sedation. Just to talk a little bit more about the possible opening of schools before the 4th of May. In the case when schools will not get reopened, are other scenarios being studied? For example, systematic remote classes, the fact that kits could be improved, because we've had a lot of complaints about the kits, that some were pretty summary, that it was almost nothing, in fact. And if children don't go back to school before September, could the teachers be expected to still be paid their full salaries, since people, talked about a question of equity compared to other people who lost their jobs? First of all, we haven't looked at scenarios where teachers would not be paid. That's clear. We are looking at all sorts of scenarios. Number of students reduced, certain regions, not have mandatory schooling. We're looking at different scenarios. I'm transparent. My team tells me that I am a little bit too much so, but I don't want anybody to get, nervous with all this. We're looking at different scenarios. We're studying different dates. However, in every scenario, we are going to be making sure that the safety of the children and the teachers is protected, and that we have the agreement of public health. But we are looking at all sorts of scenarios. My question is for Dr. Arruda. In CHSLDs, taking into account what has happened in Quebec for the past month, do you think that the measures that are being taken right now, before seeing the effect and a lowering in the number of cases, how long will that take? It's always difficult to be able to give a number, but we know that measures usually, we need to count the effect of the measure. It's around between 14 and 21 days, and after that, the effect on the diseases that will have been acquired, on the death through hospitalizations, with another 15 days. So it is clear that in CHSLDs, taking into account that there is a concentration of high-risk people where the probability of death is higher, and we can also observe here that a proportion of those deaths that took place for those people also took place in homes. So what happens in a CHSLD is a concentration of more people, more interaction with staff, but there is also a risk at home as well. So I think that all of this is also variable depending on the transmission that will take place in the community as well, because health workers could be contaminated as well, but in applying the measures with the masks and the symptoms and etc. What has not helped us at all, and what helps no one here or elsewhere, because the problem in centers for the elderly isn't just a problem in Quebec, is the situations, I would say, of asymptomatic or people with very few symptoms that introduce the virus in these premises. So I would say, I think that we're doing everything right now to reduce it, and we have to maintain it, as long as we have community transmission as well, and particularly maintaining it to avoid a second and third wave. Let's say maybe a bit before then there will be an effect, but not a total and global effect.
également à mon tour une question additionnelle, Marc-André Gagnon du Journal de Québec, et ça va répondre en même temps à une question.
This a question that was sent to us.
Vous avez effleuré, Dr.
Arruda, you touched upon the concept of collective immunity when we talked about the reopening of schools, possibly. So I would like to know, where are you at with your thought process about this question, and in which way would this immunity be able to be measured eventually? Well, it will be measured in function of serological studies, and I would tell you tests that we'll be making at large scale within the population. But it's pretty difficult, and that's why it's important to have zero prevalence tests. It's difficult to know whether it's 10, 1, 20, 30, 40% of the population that has been affected. It's clear that it's not 80 or 90%. You see that we really lowered the curve. We have not had what we had the health crisis that we could have had in our hospital centers, like what happened elsewhere. And therefore, we're looking at this. And this question of natural immunity is important, but it will be important to manage as well in order to not expose the most vulnerable. I know that there were parents who were very worried because they have chronic diseases themselves and they didn't want their children to, So we have to have strategies to protect those people as well, not just the 70 and over, but people who have chronic diseases as well, and others. And we'll see progressively. And as I told you, no decision has been made. We're looking at every scenario. We're looking at what has been published in the literature, and we'll be measuring. And each time we make a movement, as I said earlier, as I said yesterday, where we adjust things with, a dimmer, we'll see what we need to readjust. Because what we don't want is to go too quickly and after that not be able to go back, that we're kind of escalation. But we will have to, we can't stay confined for a year or 2 or 3 waiting. The more we confine, the less there is transmission. But of course, the arrival of medication and a vaccine is something that would help a lot to give immunity to the most vulnerable.
Aux questions en anglais qui, aujourd'hui, nous ont toutes été envoyées par courriel de la part de collègues qui travaillent à partir de la maison.
English questions now.
Is from Phil Autier, Montreal Gazette, for Minister McCann. We know the residence Herron has been put under trusteeship since March 29. And you have set up a team to look into the situation in the CHSLDs, but many families say they were left in the dark about the reality in these centers for months. How can this be corrected?
Oh, it will be corrected, because the first thing to do is to verify all the private CHSLD, and we're doing that today. And I'm going to get a report. And I want all the families to be contacted. That is key. The families have to be informed of what's going on, especially in light of the situation at the Herron residence. So the families will be contacted very shortly, and they should have all the information about the state of their dear ones.
And as a second question for Mr. Legault, since the COVID-19 crisis started a month ago, you have earned praise for your leadership, but after your comments about schools and daycares, many deputies and the media have been flooded with messages from concerned parents. So are you too impatient? How can you calm fear?
No, I think that even in the next few months, when we'll reopen the schools, it's clear that some parents will be scared to send their children to school. So I knew that, we knew that. But what I want to be clear about the reopening of schools is that it will not be done until we have first the agreement of the public health, and second, that I have personally the assurance that there's no risk for the children and for the teachers. So it's clear. And we'll follow in the next few days, few weeks, the situation. So we cannot say at this time when we will open the schools, but we have different scenarios at different dates, and also other scenarios about partial reopening or reopening only in certain regions. So we have right now many scenarios. So, but I want to be clear, health will be always the first criteria.
Thank you. The next question are from Raquel Fletcher, Global News. For Mr. Legault, was it a mistake to say that you would potentially reopen school before May? Wouldn't it be more prudent to wait until September?
Well, is it the right thing to tell the truth? Yes, we have some scenarios before the 14. We have some scenarios after the 14. But sometimes maybe it's not good in politics to tell all the truth. But you know me, I like to say the truth. So, but maybe the way I said it scared some people, and I'm sorry about that. But the facts are that we have some scenarios before May the 14th.
Now, question for Minister McCann concerning the residence Herron. If there was a lack of staff because employees were sick with COVID-19, why did management not flag this issue to the CU3S or even your ministry to avoid these atrocities? What went wrong here?
Well, they did flag on. They had a call on March 26, and to alert to ask them to ask the CIUS information because they had a case of COVID-19, but then in March on March 29, after contacts on the 27 and 28, the CIUS West de Lille realized that there was a big problem, and so they went. They sent a team because they realized that there were almost no people to give the services. So I think the CIS West de Lille took charge of the situation very quickly and took care of the patient, the residents. So it's a dire situation, but it was corrected. And now, as we mentioned, we realize, because we had difficulty with the owner collaborating, and we finally got the keys to open some of the areas. So we found some charts, and we realized that 30 people died in the last month, and 5 of them for the COVID-19. So I think the CIUS West de Lille did a very difficult job, but took charge of the situation and is caring for the residents at this time.
The next questions are from Valeria Corey-Manocchio, CBC News, concerning Herron. If there is a wave of death in this private care home, where's the oversight? Where's the accountability?
I'm not sure I understand.
If there's
what are the two choices?
The question was, where's the oversight regarding the resident Herron? Where's the accountability?
Yeah, but it's a private residence, so accountability in the private is to the owner. But unfortunately, the owner didn't collaborate with us, so it took more than a week before she gave us the files about each patient, and we haven't had to have an order of the court to get it. So,
thank you. As a second question, there are parents and teacher groups who say you would be rushing a return to school and wonder if sending kids back too early will undo all the work Quebecers have been doing to limit the spread. What do you say to them?
okay. I want to tell the parents that we will not rush the return to school. We will return the children to schools when we'll have the assurance that there's no risk. But right now, we don't know what will be the situation in a week from now, in 2 weeks from now. But we'll study and discuss with the public health and take the decision. What I said yesterday is that we have some scenarios before May the 4th. We have some scenarios after May the 4th. Right now, I cannot at 100% answer when we will reopen the schools, but what I can say and when I can assure the population is that we will not reopen schools until we have the assurance that there's no risk for the children.
Thank you. The next question are from Andrew Brennan, CTV News. Do you still think moving patients from hospitals into CHSLDs was the right move? Now we see how many are getting infected or dying in them.
Well, right now I want to say that the transfers of new patients to long-term facilities has stopped. What we're doing now is securing the long-term facilities and making sure that we have enough staff and that the zones are, that we've always done, but the cold zone and the hot zones are separated. So, and what we've done in the past is to prepare the hospitals, because we had to prepare for the worst scenario where we would have needed 6,000 beds, and at the same time secure our long-term facilities. We stopped the visits, we organized the teams, but this virus is a challenge. And as we said, unfortunately, our older people are the ones that are more at risk. So now we're adjusting even more because there is a community transmission. Dr. Arruda mentioned even people who are asymptomatic might be propagating it. So what we're doing right now is adjusting our interventions to the new situation, and we're going to reorganize in that sense and put more staff, obviously, to really take care of the situation.
And as a second and last question, Ontario got a lot of unusable swabs for testing for the virus. How is Quebec ensuring this doesn't happen here?
We have no problem with the number of swabs. The main item that is key for us to have more is chemical reactive. But for the swabs, we don't see problems for the short term.
So that's all the time we have. Thank you very much. Merci à vous trois.
Merci. Thank you.